My name is Molly Price, and I will be assessing head to toe my patient Norma today. So I'll get started by looking at her general appearance and see that she's dressed appropriately for the weather. She's got a pleasant mood. She's got a nice pleasant affect. She's got good hygiene, and I will assess her orientation by asking if she knows who she is.
My name is Norma.
And where she is today.
I'm in my home.
And what the date is.
August 28th.
So I will see that she is alert and oriented, and I will wash my hands. So then I'll go on to assessing her skin. She looks overall nice and pink. Her skin is smooth, it's dry, it's intact. I don't see any causes for concern. I will find a little, some sort of a lesion here we're supposed to assess. So I found a freckle. It is nice and smooth with the rest of her skin. It's a little bit brown, it's a little macule. It's about 2 centimeters. Is it tender at all?
No.
Okay, so it's not tender. No drainage coming from it. So that looks good. I will go to assessing her head here first. So I will take a look. I see that her hair is nice and blonde, it's thick, it's got even distribution throughout. Her scalp is pink. It's dry. Is it tender as I touch it?
No.
So that looks nice. I don't see any lumps, bumps, or bruises there. I'm going to take a look at her face sensation. So in her movement, so I'm going to ask you to puff out your cheeks for me and to raise your eyebrows as high as you can. Very good. I'm going to see if she's got equal sensation on both sides of her face. So we're going to, does that feel the same as this?
Yes.
And does this feel the same as this?
Yes.
Very good. So then we will take a look at her eyebrows. I see that they are nice and blonde, even distribution. They're not coarse at all. And I'll take a look at her eyelashes and see that they are intact. They're also good distribution. They're not inverted at all. Then I will take a look at her temporomandibular joint here. I'm going to palpate that, and I'm going to ask her to move her jaw up and down. Very good, and side to side, and jet your jaw forward. Very good. So I'm going to palpate that along with your temples here, and then I will also palpate that temporal masseter muscle. So go ahead and clench your jaw, and then I'm going to feel your temples as well. So that feels equal bilateral. It all feels good. No causes for concern. Let's see. Let's see. Then I will move on to her lymph nodes. I'm going to palpate her lymph nodes, starting with the preauricular, and we'll go to her postauricular, and we will do her tonsillary and her occipital, and then we will do her submandibular and her submental. We'll find her deep cervical chain and her posterior cervical chain and her superficial cervical chain, and we will do her supraclavicular, so if she can kind of shrug in like that, we'll find those along her collarbone here, and your infracurricular, or clavicular, sorry. Oh, very good. So then we will go on to your eye assessment here, and I will first take a look at just your general visual circumference, general visual confrontation here. So just tell me when you see me in your peripheral.
No.
Very good, and
No.
good. And I'm going to do your 6 cardinal fields of gaze here. So if you could take a look here, and then we're just going to go up, and side to side, and over. Very good. So I see that there's no causes for concern there. I'm going to take a peek at her pupil size. So it looks like she's got about 5 millimeter pupil size right now. We're going to do the red eye reflex. So we don't have the proper instrument to do that, but I'll just speak to that. as well as Perla. So I'm going to see that her pupils are equal, round, intact. They react to light, and we'll do accommodation here. So if you could just look here and we'll go in. Very good, and I will assess your pupils here. Good. Another one. Good, so they do react equally to light, so that looks really good. We already looked at her eyebrows and her eyelashes. I'll take a look at her sclera. Her sclera is nice and white. There's no drainage noted from that, and I'll also look at her conjunctiva and see that it's pink and moist, no drainage coming from there. Let's see. We'll also look at her ears, so if she can turn to the side, we'll see that her ears are nice and in line with the auricle, so the position of the ears. Let's check bilaterally here. That looks good. The auricle is nice and in line with that, with her temple. Her eyebrow looks really, really good. We'll then move to her nose. We're going to assess the tip and the bridge and the dorsum, the symmetry there, just the general appearance. It looks really good. I will see that there's no abnormalities. I also check the patency as well. If she can just plug one side of her nose and sniff in and blow out, and do it with the other side. Very good. And then I'll just take a general peek inside real quick and see that, just your nose real quick, and then see that her mucosa inside her nose looks nice and pink. No drainage noted. If there is a little bit of drainage, it might just be nice and clear. No causes for concern, so she looks really good. Next, we'll move to your mouth. I'm going to take a peek inside. I'm going to look at your buccal mucosa. Nice pink and moist, no redness, no white spots noted. I'm going to look at her teeth and see that there's no dental caries. Her gums look nice and red and pink. Everything's nice and moist. I'm going to look at her tongue and see that it's nice and red. I'm going to check the strength of her tongue by having her go side to side, moving up and down. And if we had a nice piece of cloth, we would test the tongue strength by having her press against our tongue that way. Then I'm going to look at her throat and see that I see her fossa. It looks, she can stick her tongue out for me. It looks like she's had her tonsils removed. And I also see, can you just say ah?
Ah.
I see a nice bilateral and symmetrical uvula back there. And I'm going to take a peek at the throat as well and see that she's got her hard and soft palate back there. It looks nice and intact on both sides. The hard palate back there and then the soft palate in front there. She just moves her tongue up, so it looks really good. Very good. So we are going to also look at her throat. I'm going to see that her trachea is nice and in line. Midline, it is symmetrical. I'm going to look at the, you hear a baby crying in the background. Get a little distracted there. Let's see, I think we did let's check her shoulder shrug and her sternocleidomastoid. So you could just shrug against my shoulders, very good, good strength. And then push against my cheek, good. And then other way, good. So that is the sternocleidomastoid muscle. So that all looks nice and strong too. Now I'm gonna look at her anterior thorax, and just by starting out to observe, I see that she's got a nice round chest, symmetrical, no barrel chest. It has a nice 2-to-1 ratio. I'm going to assess her respirations right off the bat. Watch her for a full minute and see that she's got breathing about 16 respirations per minute. The rate, the rhythm, the depth, the ease, all that is nice and even. She's breathing unlabored. She looks really, really good and relaxed there. I'm going to take a peek and just just do some general palpations, see if I can find any lumps or bumps, any masses, any tenderness. So just tell me if anything is tender. So we'll go everywhere here underneath your bra strap. So we'll do this anteriorly first. So does anything feel very good? And then we'll do go on and test her tactile firmitis here. And I'm going to use the back of my hand and the palm here for different spots. So if you could just repeat 99 every time I move my hand.
99, 99, 99, 99,
Very good.
99, 99, 99, 99.
Very good. So I'm going to do that against all of her lobes. I didn't feel any abnormal vibrations. So she looks good there. I'm going to take a listen. I'm going to listen to all lobes and see if I can hear any adventitious breath sounds here. So for time's sake, I'm just going to place the stethoscope where I would listen here. Very good. So I think we did everything anteriorly. How can we move this in? Okay. And I think we're going to move to the posterior. I'll have her just kind of turn to the side a little bit for me there. So I'm going to start right off the bat with just some general palpation, seeing if we find any lumps, bumps, bruises, anything she doesn't know is there. Any tenderness, so just let me know if you feel anything, if anything's uncomfortable. While I'm back here, I'm going to go ahead and assess her costovertebral angle tenderness here. So let me know if anything is sore back here.
Yeah.
Very good. And I'm going to go ahead with the tactile firmitus again to the back. So if you could just repeat 99 every time you move my hand.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Very good. And we want to make sure we get go all the way down the back is low enough to get underneath that bra strap there and hear every lobe. Then we are going to percuss here. So we're going to do middle finger to middle finger here if we hear anything abnormal. Good. And again, we're going to want to do that in all lobes down her back. Did not hear anything. It all sounds good. Nothing abnormal. And I'm going to now listen to her. Same thing. I'll just speak to where, or just point to where she is. I will be listening. I did not hear any adventitious breath sounds, no thrills, no rails. All of her lungs were clear. Nothing was diminished. It all sounded really good. So I would say that she's got nice and clear lung sounds. So make sure we got everything on the lungs. And I believe we did. I think we're going to move on to the heart now. First, I am going to listen for 1 full minute at the point of maximum impulse here at the apical pulse. So I'm just going to speak to listening for a minute, but I'll put my stethoscope where that should be. Then I'm going to listen to all 5 areas of the heart. And we'll do that with the bell and the diaphragm, and I will just point to where those are. So we'll start with the aortic, pulmonic, Erb's point, tricuspid, and the mitral valve. And again, we do that with the bell and the diaphragm. I hear nice S1, S2, no thrills, rails, anything abnormal with her heart. It is audible and sounds good. So that is, let's see. I think that's it with the heart. So yes, just nice S1, S2, healthy heart is what I hear. Next, I think we'll have her go ahead and lay down on her back. I'm going to assess her stomach. So, I don't know, actually, if you want to speak down this way a little bit, it looks like our camera, we're out of there, sorry. There we go, perfect. So, first I'm going to, just for privacy, we're going to leave her shirt down, but I'm going to assess for any striae or vascularities on her stomach. I don't see any of that. She looks nice clean skin, nice clear skin. We're going to assess the umbilicus for any signs of a hernia. Normally that's pretty sore, so if she were to have any signs of a hernia, we would probably know about it pretty quick upon palpation. We're also going to just look at the general contour, symmetry, and movement of her stomach. It's nice and flat. I don't see any abnormal movements one side or the other. It's nice, equal, bilateral. Nice and flat. It looks good. We are going to, let's see. We did the hernia. Let's see. Take a peek at her bowel sounds real quick. So we're going to listen to all 4 quads for 1 minute. I'm just going to speak to that, and I'm actually going to listen for all 1 whole minute for each sound, but we are going to listen for vowel sounds present in each abdomen. See if they're hyper or hypo. I'm going to note that her vowel sounds are present in each quadrant, and it sounds good. Sounds like she might have just had dinner there. And I'm going to start off with some light palpation first here. Just kind of general, we're going to go to each quadrant here, see if anything's tender. Always start with light palpation. And then we're going to do a little bit deeper. Tell me if anything's tender. No? Very good. And then I'm going to palpate for her liver here. So we're going to look on this left side. I'm going to come see if I'm still in the camera here. I'm going to have her breathe in and breathe out. And I'm just going to do that hook, see if I can feel her liver. I can't, so that is good. And then I'm going to assess her spleen over here. For the spleen, usually we don't feel the spleen or the kidneys unless the person is extremely, extremely thin, or there's something very abnormally wrong with the spleen or the kidneys. So I don't feel her spleen upon palpation, so that's good. And I'll also check for her kidneys. Is anything sore? Palpate those. Very good. Check the other side there. No. Very good. All right, I can go ahead and sit up. Okay, no problem. Alrighty, so next we will go on to checking her vasculature status. So I'm going to take a look first and see any clubbing on her fingernails. I don't see anything very good. Check her capillary refill. We want it to be less than 3 seconds, so we'll check each finger here. I'll just speak to that, but all of her capillary refill, we'll check that on her fingers and her toes. That is less than 3 seconds. Check for her skin turgor here. Very good. So she's got nice turgor. And then just the warmth, the temperature here. Again, her skin is nice and dry. She's warm. It's nice and pink. She's got healthy looking skin. I'm going to take a peek for edema, both for her upper extremities and her lower extremities. I don't see any edema noted anywhere here. Let's see. And I'm going to check her lower extremities for any signs of hair distribution, for her hair distribution down here. I see that she is newly shaved, but just a tiny, tiny bit of stubble, so we can see that she's got good vascularity flowing through the bottom of her legs. I think we will check her pulses now. So we will do check them bilaterally here, but I might just kind of skip around to one side just for time's sake. But we'll start with her carotid arteries. Carotid pulses there. We'll do her brachial, and her radial. And then we're going to check for her femoral pulses as well. Kind of hard to feel for in shorts, and but that'll be right in there. And then we'll also get her popliteal, which are back behind here. Hard to find on people usually, but that is right back here. And then we'll go back here, and her posterior tibialis is back here. And her dorsalis pedis is right kind of where that strap in the sandal is. So we would want to look both sides. We want to go make sure that all of her pulses are equal. We're going to grade them. I would say that the majority of her pulses were 2+, equal, bilateral. Nothing, she wasn't bounding. I think she's nice and relaxed here right now. So I think that is that. I'm going to go ahead and go check her sensory here. So we're going to look at her upper extremities, her trunk, and her lower extremities, and check her sensation for sharp and dull. But first I'm going to check her proprioception, her graphesthesia, and her serognosis here. So Norma, if you could just close your eyes for me and hold out your hand. This is checking her serognosis. So if you could just go ahead and tell me what that is in your hand without looking at it.
Bobby pin.
Perfect. And we'll do the same with the other hand.
A pin.
Very good. Now, for the graphesthesia here, I'm going to draw a shape in your hand and just tell me what you feel the shape is.
Circle.
Very good.
Square.
Awesome. And then for the proprioception, I will either point Norma's toe up or down, and she's going to tell me, it's just about being aware of your body, if her toe's up or down.
Down. Up.
Very good. Then I will go to assessing for if her sensory, if it is sharp or dull. Do that on her upper, lower, and trunk extremities here. So just tell me if this is sharp or dull.
That's a dull. Sharp. 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 Dull.
Good.
Dull. Or sharp maybe.
That was sharp. Very
sharp.
good.
Yeah.
There we go.
Dull.
Kind of tough through clothes.
Yeah. Sharp.
Down here.
Sharp. Sharp. Dull.
Very good. We'll check her lower extremities here.
Dull. Sharp. Sharp. Dull. 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 Sharp. Dull.
Very good. So she's kind of getting nervous here. A little test here. So very good. She did good with that. Next, I will go to her deep tendon reflexes. So I will go ahead and I will assess her brachial first. So go ahead and just nice and relaxed for me. So we'll go like this. Nice and relaxed. Very good. I'll do her triceps here, so nice and relaxed. Kind of get that spot there. There we go. And then her brachioradialis here. So I'll make that nice and relaxed there. There we go. And then we'll do her knee. So if you could, I don't know if you can go back a little further in the angle. There we go. And we'll do her ankle. Nice and relaxed. There we go. And her plantar. And then, let's see, sorry, her plantar is actually at the bottom of her foot. Let's see. So we'll kind of draw an S down here and see if she curls in. Does that tickle? Sorry. Yeah, that's definitely reflexive. And then we'll also check her clonus. So I will put her foot back like this and see, and just let it as far as it can go, and then let it go. So relax. There we go. So no abnormal palpations forward. If she were to palpate here forward, then that would be abnormal, but she did not, and that looks great. Awesome. Next, I'm just going to do kind of a general overview, see if she's got any masses, any tenderness, any contour problems here, redness, warmth, swelling, anything abnormal. We're going to start with her shoulders. So it's mostly just palpation here, just checking her shoulders. We're going to do her arms and her hands. Very good. Kind of check both sides here bilaterally. We're going to do her neck and her spine. Is that tender back here? Norma's always got kind of a sore neck.
Generally.
Oh, and then check her spine here. I see no signs of overly tender. Maybe her neck might be a little bit tender, a little bit swollen. She's got a hard desk job, so. But contour issues, no redness, swelling, anything like that. And then we will do her, kind of check out her hips, see if anything is tender here. Do her knees. Let's see. I'm going to check for any crevice here. There we go. Kind of check her ankles, her feet, toes, legs, all of that. I don't see any problems, any abnormal redness, swelling, warmth, tenderness. Again, contour issues, mass. She's symmetrical up and down. And then we're going to check her range of motion. If you could stand up, we're going to do a couple range of motion exercises here. So, I don't know if you just want to maybe face me. We're just going to kind of check your shoulder range of motion. Do that. Go back here. Kind of stretch way out. Good. How does that feel? Are you tender?
No, it feels
crazy. Good. Then we're going to check your elbow range of motion. Kind of go out and let it hang. Very good. We're going to check your wrists. We're going to check your thumbs here. We're going to adduct and abduct here. Kind of go in a circle with those thumbs. And check your grip. So go ahead and squeeze my hands here. Very good. Next we're going to kind of check that spine. So we're going to turn forward. And I'm just going to have her kind of touch her toes, reach down. Stretch those hips out wide and check that spine. Looks good. Range of motion there. And then I'm going to kind of all the while we're kind of checking for crepitus here. So I don't see, when she was doing that range of motion here, we're no crepitus. I have her sit back down and again, and we're going to check the range of motion in those knees, hips and ankles. So we're just going to kind of flex forward. Good, and then kind of go around in a circle with those ankles and make sure those toes got good range of motion on your feet, ankles, toes. And then I'm going to, stand up one more time and we're going to look at those hips. So we're going to, let's go abduct, and we're going to adduct, forward, good. We're going to look at the other one. Very good. Kind of just go adduct, go abduct forward, very good. All right, so I think our head to toe assessment is complete. Thank you, Norma, for being my patient today.
You're welcome. My pleasure.